Welcome, everybody. I see people are still joining us, but my name is Montserrat Serra, and I am with the Department of Medical Assistance Services. We call it DMAS, and at DMAS, we administer the Virginia Medicaid program. I appreciate everyone joining us today. We have a very interesting theme this time for our forum. We're going to be discussing insights on implementing a language and disability access plan. So I hope that everybody enjoys the discussion and enjoys and learns from today's information that I think is going to be very helpful for everyone. I wanted to say thank you to my team members. We have part of the organizers, we have my supervisor, John Stanwicks, and Jesus Perez. Jesus and John, we are part of the Civil Rights Unit at the Department of Medical Assistance Services, and we're a small unit, but we accomplish a lot of work for ensuring that language assistance services and disability accommodations are provided to the Virginia Medicaid applicants and members. I'd like to provide a few words about the background and the reason why we have put together this forum. And this goes back into 2021 when I first, even before that, when I first started here at DMAS, there was a goal of having a language and disability access plan written for the agency. And one of the goals that was identified when we wrote that plan was to have a forum on an ongoing basis where we could touch base with our stakeholders and make sure that we learn from others and make sure that we provide services to limited English proficient individuals and also individuals with disabilities so that they can participate within our Virginia Medicaid program and services. So we decided to implement a forum which is open to the public. That's why all of you have been invited to participate, and with the hopes that everyone can learn from each other and share great information about how we can better provide services to individuals with disabilities and people who are limited English proficient. I wanted to highlight that the forum is for informational purposes only, and it should not be considered as legal advice. So we share our resources and our information, but hoping that is just for informational purposes. So don't take it as any legal advice, please. And also wanted to let you all know that the forum will be, or the recording will be available at the DMAS website at a later time. Usually take us 10 days to 15 days to upload all the information. But we have a page in the DMAS website where we have posted all of the forums that we have completed. We complete 2 forums per year, and today's forum is the last one for 2024. So far, we have completed 4 forums, and in 2025, we will have one in May and another one at the end of the year as well. So let's go over very quick through some of the logistics. And as I said, this information will be available in the DMAS website. I will be sharing the presentation so that you can all also have access to the links that are in the presentation. And while I running through these logistics, if you don't mind writing your name and the organization that you work with in the chat, so that way we can all see a little bit who is attending, and it feels like it helps us understand better our audience and how we can gear that information. Also, I wanted to let you all know that there are automated closed captioning for the event, but we also have remote conference captioning, which is available through Transcriber, through Virginia Relay. And Jesus, my colleague, has been pasting the link to access the RCC if you need to follow the event through those captions. We also have 2 American Sign Language interpreters, and if you need to see them, you can pin them, and all you have to do is click on the 3 dots and you can pin their image so that you can follow them better. If you experience any technical difficulties, just send us an email to the Civil Rights Coordinator at DMAS.virginia.gov account, and we'll take care of it if you're experiencing any technical difficulties. And if you have any questions throughout the presentation, please feel free to enter them in the chat, and we will address them at the end of this presentation if we have enough time. If we run out of time, we will be happy to collect all the questions and share the answers at a later time. All right, so back to the content of the forum. As I said, I think we have a pretty interesting agenda today. We will start with welcome and introductions, and then an opening keynote that's going to be done by Terry Morgan, who is the Executive Director for the Virginia Board for People with Disabilities. We will have a short presentation that I will provide, and the presentation is going to be its title, A Sample Approach to the Implementation of the DMAS Language and Disability Access Plan. I think it's going to be very interesting for everyone because I will be sharing the steps that the Department of Medical Assistance Services completed to implement our own language and disability access plan. Then around 1:30, we will have a very interesting panel discussion. I'm very excited for that. We have invited as panelist Craig Pfeiffer, who is the Senior Advisor to the Commissioner for the Virginia Department of Social Services. We will also have as a panelist Yvonne Simpson, who is the Senior Director in Language Access and Cultural Advocacy for the University of Washington Medicine, Jason Hubbard, who is Associate Director, Spanish and Foreign Language Interpreters for the University of Rochester Medical Center, and Morgan Underwood, who is the Associate Director of American Sign Language Interpreter Services for the University of Rochester Medical Center. So that's going to be the bulk of our forum, and I think we're going to have a very engaging conversation with all of them about how they have implemented policies and procedures in their organizations and a language and disability access plan. Towards the end, we estimate around 2:45, we will have an open session for questions and answers. Any questions that you might have throughout the presentations, please put them in the chat. My colleague Jesus is collecting all those questions, and at the end, if we have time, we will be able to go through some of the questions, and then we'll just close the event. So let's move on to our opening keynote. I'm very excited to have Terry today. Terry Morgan, as I said, she is the Executive Director for the Virginia Board for People with Disabilities. And thank you, Terry, for being here today. She brings over 35 years of experience advocating for individuals with disabilities and their families. Her career includes leadership in private nonprofits, delivering direct services, and managing Medicaid home and community-based programs. 14 years as a program manager with the board, and 6 years at the Department of Medical Assistance Services, focusing in waiver operations and policy. Returning to the board as Executive Director in 2020, Terry remains dedicated to advancing inclusion and equity. So Terry, the floor is with you, is yours if you would like to provide us a few words to open our forum. Thanks for being here.
Yes, I'm really pleased to be here, and good afternoon, everybody. I would first like to thank the Department of Medical Assistance Services for inviting me to join you today in this important discussion and for being a leader in language and disability access in Virginia. Today's discussion offers an opportunity to reflect, share, and innovate on ways to make our communities more inclusive and equitable. Today's discussion sits at the very heart of inclusion and equity, language access for individuals with disabilities and those with limited English proficiency. Language is more than a communication tool. It's a bridge to opportunity, autonomy, and dignity. And for many, however, this bridge comes with barriers that can lead to exclusion from critical services, meaningful civic participation, and even basic human rights. This is particularly true for people navigating life with disabilities or limited English proficiency. The Virginia Board for People with Disabilities has long recognized that language access is a cornerstone to meaningful participation in community life. Through the board's assessments of information access for people with disabilities and their family members, and the board's assessment of the information ecology of the disability services system, the board has sought to identify gaps in language access and address the broader information ecology. These efforts aim to ensure that all Virginians have access to critical information and services. Perhaps the most significant lesson learned is the critical role of community engagement. The Virginia Board's success in uncovering systemic barriers has relied heavily on direct input from people with disabilities and LEP communities. Their lived experiences have provided invaluable insights into where the system is failing and what changes are needed. Information access is a decades-old problem. It's not new, but now is the time to make sustainable change in language access because we have more knowledge, more resources, and technology at our disposal than ever before. Advances in assistive technologies, language translation services and resources, communication tools provide us with unprecedented opportunities to bridge gaps and reach diverse communities effectively. Furthermore, the growing recognition of inclusion and equal access as a societal priority has created momentum for meaningful action. We know what works, what doesn't work. We're better equipped to design systems that are inclusive, culturally competent, and scalable. The tools and insights are in our hands. As we discuss strategies and solutions today, let us remember that language access is not just about compliance with laws and regulations. It is a commitment to inclusion, a recognition of diversity, and a promise to uphold the inherent value of every individual. Whether through accessible technology, multilingual services, or culturally competent support, every step we take to improve language access is a step toward a more just and connected society. I look forward to the insights and actions that will come from today's conversations. Together, we have the power to ensure that no one is left behind, regardless of the language they speak or the challenges they face. This ongoing commitment to systemic change serves as a model for how other states can better support their diverse communities. The Virginia Board for People with Disabilities is excited to be a part of this work, and we look forward to continued collaboration and engagement. If you're interested in learning more about the board's assessments, I mentioned 2 of our assessments that we've completed within the last few years that have really been, a guiding light for our work around information access. That's the information access for people with disabilities and their family members, and our information ecology assessment. I encourage you to look at our website. Those assessments were developed with direct input and engagement with the disability community and LEP communities. So if you can Google the Virginia Board for People with Disabilities and review the assessments, our findings, and a number of recommendations that really attempt to address the systemic barriers, some of which we're talking about today. And while you're there, I encourage you to look at our Information Access Champions Initiative and consider pledging your organization to be an information access champion, where you are making a commitment to, first that you're acknowledging the information access barriers, occur, and making a commitment to do better. And I think what we all learn from each other today, and just this ongoing dialogue and ongoing work can move us all forward as a system. One of the things that we've learned is that information access challenges don't belong to one single agency or one organization or one community. It's a systemic issue. and a systemic solution is needed. And that means we all need to work together, and we all need to have a commitment to use the resources and tools and knowledge that's available to make sustainable change. So again, the Virginia Board is very excited to be a part of this work, to be engaged with you all, and to be here today, and appreciate DMAS for the work that they're doing. And I will turn it back over to Montserrat.
Thank you so much, Terry. This has been very, very inspiring. Having over 35 years of experience supporting individuals with disability, not only the individuals, but also their families, it's very impressive. I have enjoyed a lot working with you and other state agencies to make sure that we implement language and disability access plans, to make sure that we have initiatives in place to make sure that we move along with technology so that no one, as you said, is left behind. So I really appreciate you being here today and inspiring all of us with the work that you're doing. And we hope that we can learn more from the Virginia Bureau of People with Disabilities. Thank you.
Thank you.
All right. So we're going to move on to the next part of the forum, which I usually provide a little bit of information on a particular topic. As the theme for today is language and disability access plans, I thought that it would be a good idea to maybe share some experiences that we have gone through with the Department of Medical Assistance Services to build our own plan. So I think you're going to find this very interesting. If you have not started your plan, this is going to be a wonderful resource, we hope to. If you have already started or you have already implemented this plan, as you know, part of our duty is to constantly monitor our plans and make the necessary changes. So I think this information will be also very helpful for you. All right, so first of all, I just wanted to go a little bit over the regulatory framework, specifically the CMS Final Rule, Section 1557, and how this rule mandates that by 2025, agencies under the Health and Human Services should implement policies and procedures or a language and disability access plan. So not only this is a regulatory, sorry, I'm having issues with my screen. So this is not only a regulatory requirement, but it also is a need to enhance service delivery and ensure that individuals receive the support that they need to access services. So having a plan in place, a written plan for each organization, is fundamental, and not only to meet compliance, but also to improving service to individuals with disabilities and individuals who are limited English proficient. In today's presentation, we will go over several key steps that DMAS took to implement their plan. We will start first with the needs, understanding the needs assessment, and then how we started writing the plan and a timeline of how this happened, and then finally our experience with the monitoring aspects of the plan. At the end of the presentation, we will be sharing some practical resources that you can use to implement when you complete yours, and hopefully it'll help other organizations to implement their plans. So I wanted to take a closer look with that particular regulation, which is the Section 1557 of the Affordable Care Act. There is a final rule that requires meeting the May 6, 2025 deadline to implement written policies and procedures for language and disability access services. The deadline to comply or complying with this requirement not only will by complying with this requirement, not only organizations will meet federal requirements, but they will also ensure that they are providing equitable services to LEP individuals and people with disabilities. And overall, this will help eliminate barriers to healthcare access and provide a better overall service to all populations. So now that we understand the reason behind and the impact, let's go over the core components that DMAS completed and also the DMAS commitment. As I said, providing equitable services for LEP individuals and people with disabilities is a high priority for our agency. And that is the reason why we decided to implement a comprehensive plan to meet not only those needs, but also the legal requirements. The main core components of our plan is a needs assessment, and this is pretty much an evaluation of the language and disability access needs that we determined for our own agency. Then another step was to develop the plan. So pretty much writing the plan, put that information on paper as far as the commitment and how our agency was providing language and disability access services to our members and applicants. Then another big component on the plan is the implementation aspect, which pretty much is just making sure that our own DMAS staff and our contractors, they are aware of the guidelines and the resources and their responsibilities to provide language and disability access to individuals with disabilities and people who are limited English proficient. And then the last core component of implementing our plan was the monitoring and the updating piece, which is pretty much the ongoing piece where we continually track trends and update the plan as needed. So let's go over a little bit. I think I tried to make this slide a little bit colorful and with illustrations so that you could understand a particular timeline that we follow when we completed our plan. So if we go back to 2020, that's when our agency completed the needs assessment. The needs assessment that we completed here was based on having one-on-one interviews with division directors, where basically I went through all the directors at the DMAS, and it's a pretty large agency. So I spent quite some time meeting with directors, and I had a set of questions where I wanted to determine what were the needs, what was being provided at that time, and if there were any gaps of services to language services. And after meeting with the directors, we decided to start creating SharePoint site where it's an internal site where we started posting helpful information for DMAS staff and others to follow our progress with completing the plan. And then in 2021, that's when we started putting the plan in writing. So started grabbing a piece of paper and putting all the information that we had collected from the DIS assessment, and then informing others on what was DMAS doing at that time as far as providing language services and disability access services. Then in 2022, we started providing training to DMAS staff. We implemented 2 phase trainings. One was an e-module where individuals at staff at DMAS were able to just complete a 30-minute e-module on their own pace. And then we also did a webinar. It was a couple hours long webinar where we provided all the information that we put in the plan and how DMAS staff pretty much training them about the responsibilities to provide language services, how to utilize phone interpreting services, and also how to manage any translations requests or any other type of language services. So that was implemented in 2022. And then towards the end of 2022, we also put together the set of policies and procedures to make sure that we had them posted in the SharePoint page, that we had also them included in the plan, and pretty much that was kind of like the from 2020 to 2022, how this plan was implemented. At the end, our plan was reviewed by our leadership. It was also reviewed by the Office of the Attorney General. And then eventually, after all the revisions, the plan was uploaded for the public, and it's available on the DMAS site. And at the end of the presentation, you will find a link to our plan. In the meantime, I wanted to specify from this slide that we have ongoing initiatives. So this is not an end project. And this is something clear that everyone that is investing their time in putting together a language and disability access plan, that they consider that this is not the end, that continuous work needs to happen. We update our plan on a yearly basis, and we also implement training on a yearly basis and refreshers trainings. So, and we also address any updates on regulations and things like that. Also, we monitor the usage of language services. We monitor the frequency used languages. If there's any frequent use language that is needed more for other years, and this sometimes attaches with the refugee population. If we have a large amount of refugees that utilize a particular language, we make sure that that is accommodated during reviews to the plan. So that provides you a little bit of a high summary of how we implemented the plan here at DMAS. And just wanted to provide a little bit more details on the conducting of the needs assessment. Again, the purpose of the needs assessment is to help the agencies determine if they effectively communicate with LEP individuals and people with disabilities. So, for example, when I met with division directors, one of my questions was, okay, how does your team interact with the public? Do they see them in person? Do they get phone calls? Some of our divisions, they didn't have a lot of interaction with the public. Other divisions, like for example, the appeals division, they have a closer interaction with members and appellants and applicants. So at that point, I would go more in depth with questions about, okay, so if you have interactions with members, how are those interactions are currently being done with those that are limited English proficient? And then, you know, they provided me with the information of what was being done. They had already set up a phone interpreting service, and that's how they would communicate over the phone. So capturing that information was very important at the beginning of the process, because we wanted to know what was being done, what resources we already had in place, and if there were any gaps or services, it was very important to document those in the plan so that we could we established like 5 strategic initiatives to complete within the next 5 years. So that is a very important aspect, that it all develops from the conducting the needs assessment. At the end of the presentation, I'll share there's a very good resource from the Department of Justice in regards to the language access assessment and planning tool. It gives you, and that's the tool that I use to complete the needs assessment. It gives you the particular questions that you can ask when you're doing the needs assessment, and I think it will be very helpful for you if you're in the process of completing a needs assessment for your agency. All right, so as far as the components for the needs assessment, these are the main focus areas. So it's very important when you complete the needs assessment is that you understand the interactions with the LEP and disabled individuals. Is it over the phone? Is it mainly through your website? Is it via email? So that is a very important aspect to identify. You would also need to, during that needs assessment, identify and assess the LEP and disability communities. For example, for agency, I was able to research who or what kind of frequency of languages we had. So I was able to get some data because we were capturing and we continue capture at this time languages that individuals that are applicants or members of the Medicaid, what languages they speak. That information was very relevant. It was very relevant also to understand what type of population and what type of disabilities our population has so that we can accommodate those needs. Also, another important focus area was identifying language and disability access gaps. So, for example, in particular, I recall this example that I met with the reception team at DMAS, and they had someone that could attend questions that were in Spanish, so they had an interpreter working with that. But for other languages, they didn't have a system in place to attend any of those calls. So we make sure that was a gap that we identify at that point, and we just put the implementation in place to make sure that at the reception area, although DMAS doesn't receive a lot of people visiting our agency, but it was very important that at least for us, the reception would have access to phone interpreting services in case someone who was limited English proficient, they would be able to communicate with us. And another important focus area for a needs assessment is evaluating the staff training needs. So if your agency needs to have civil rights training or some sort of language access training, that is important to identify when you complete the needs assessment, and then also the monitoring and tracking trends. The methods for conducting a needs assessment, that is very relevant. As I said, for DMAS, we went through the interview method, but there are other ways on how your agency can perform that needs assessment, either with surveys or questions or focus group, or analyzing the data that you have. Those are different methods that needs assessment can be conducted. All right, so what is really a language and disability access plan? And the plan can have different names. When I work with the local agency, the local Department of Social Services, prior to working with DMAS, I was working at Chesterfield, Colonial Heights Department of Social Services. And at that agency, I monitor what they call the language access plan. So each agency might call it different. Nowadays, it's important to capture in the plan not only the language access needs for limited English proficient, but also capturing the disability access needs. So that's why at DMAS, we call it a language and disability access plan. But pretty much what it is just a document detailing how an organization will provide accessible services to LEP individuals and people with disabilities. So that is the main bulk of the plan. You just want to make sure, and at DMAS, we make sure that we explain to the public what are we doing and how do we provide language services for individuals that need it. So not only during, for example, a phone interaction, but what do we do when we send notices to limited English proficient and also individuals with disabilities. So in our plan, that's what we highlight. And then it is important to highlight that plans have to be customized. So what I'm sharing here, it's our particular experience with our agency, but each agency has a different set of of clients or individuals that they engage with their agency. So it has to be something different for each agency, although there's main components of the plan. And let me share some best practices that we felt were very helpful for us. One of them was to engage leadership. That's a very important aspect, to make sure that from day one you get leadership involved. So communicating with them what you're doing, the goal of the plan, and getting their buy-in from the very early stages helps a lot. We are lucky at DMAS that our leadership got engaged from day one, and they help with any of the tasks that we needed to complete with the plan, and just having them involved from the very beginning. When you reach the end with the final approval, they will not be shocked to see, oh, what is this, right? So they have been follow the whole process. So that's very important. And also involve stakeholders. So gather feedback from staff and the communities that you serve. That is a very important aspect. And then make sure that you publish the plan. So if you have completed a plan, it is important that the public knows about it. For example, we publish it in our website, but if you have also a SharePoint page, or you want to have a printed copy, we also have some printed copies that we pass along the community. So those can be very successful tips to have your plan complete. So overall, this is the end of my short presentation. But overall, again, the key takeaways is, first of all, there's that compliance deadline at this time for health and human services agencies, where it says that they must have written policies in place or language and disability access plan in place by May 6, 2025. And we also talk about the importance of the needs assessment. That's the very first step to take when implementing a language and disability access plan. Also important to know that although there are common parts in a plan, each plan should be tailored to each organization. We are not all the same. We don't all have the same processes in place or same type of individuals that we engage with, or same type of services, or different type of engagement with phone or verbal. So every agency should tailor the plan to their own needs. Also, as I said, we will be sharing some resources that you might find helpful. And the last piece, which is very important when you implement the plan, is to make sure that you continue monitor the plan, that you provide updates and reviews, and that you continue monitor the language trends in your population and the disability access needs. So that's all I have for today. I hope this information has been very helpful. If you have any questions, feel free to send them through the chat. Again, if you want to send us or email me directly, you can also do that with those questions. We will make sure that we can answer as far as what we did at our agency. But now I'm very excited for the next section of the forum, which is the panel discussion. And I'm happy that I'm not going to be the only one talking here, but we have invited today from the Virginia Department of Social Services, we have Craig Pfeiffer. We also have from the University of Washington Medicine, Yvonne Simpson, and from the University of Rochester Medical Center, we have Jason Haber and Morgan Underwood. Thank you all from being here today. We will go over through a set of questions. We have some like 6 to 7 questions that we will ask them. And this is the goal of this discussion is, like if we're having a coffee break or something, where everyone can share their experiences with their organizations. And I think this is going to be a very interesting conversation where everyone can learn from each other. So let me see Let me make sure that everyone is here, but let's start with introductions. So Craig, if you're here today, if you're here now, just provide us a quick introduction about who you are and what's your main role for your agency.
Great. Well, thanks very much, Montserrat, for having me, and thanks to everybody at DMAS for doing these webinars, which have been really great resources for the community. I know that I've benefited in my work from attending these webinars in the past, so I'm honored to be upgraded to panelist today. I am the Senior Advisor to the Commissioner of the Virginia Department of Social Services. We are one of Virginia's largest state agencies. We are responsible for programs that serve about 1 in every 4 Virginians and help everybody ensure a life in safety and well-being and dignity and in independence. So we are responsible, along with DMAS, for medical assistance services under the Medicaid program and related programs. We're also responsible for temporary assistance for needy families, or TANF, the Supplemental Nutrition Assistance Program, or SNAP. We also do child care assistance, energy assistance, adoption, foster care, child protective services, child support enforcement, Office of New Americans, including refugee resettlement services, volunteerism, and probably some other programs I didn't name. So we administer about $20 billion in public assistance and other programs, serving over 2 million Virginians every year, or about 1 in 4 Virginians. And my role as senior advisor has largely involved customer experience improvements over the last couple of years, which has been a major focus of our agency's work. And along the way, I became the de facto language and disability access coordinator for the agency. I'll talk a little bit more about what that means and doesn't mean. And we view language and disability access as a key component of the customer experience. We have about 1,300 state employees, and we work in partnership with our other health and human resources agencies like DMAS, and also with 11,000 local government employees at 120 local departments of services around the state, and also community action programs. So one of the interesting aspects of our work on language and disability access is the fact that we're responsible for a lot of programs that we don't directly administer on a day-to-day basis. So I appreciate the opportunity to be here and look forward to the rest of the chat.
Perfect. Thank you. I appreciate you being here. So yeah, let's move on. Jason, would you mind introducing yourself and letting us know your role for your agency?
Yeah, happy to do so. So my name is Jason Hubbard. I'm the Associate Director for Interpreter Services for Spanish and Foreign Language Interpreters. So my subject matter expertise has to do primarily with spoken languages, and we have a separate program that handles our American Sign Language program and folks with other disabilities. So my role within the organization is to oversee the daily operations of interpreter services implementation, so providing language access services not only to bridge linguistic but also cultural gaps in patient interactions that they have with their providers each and every day. We are an 886 licensed bed facility, including a level 1 trauma center, and we have every subspecialty that you can think of under the sun. So our interpreters do have to be quite knowledgeable across all of those different subspecialties, and not only have the linguistic knowledge, but also the cultural knowledge to be able to make that information be meaningful to help our patients. So the services that we provide to the community are primarily healthcare service based, of course, and that includes anything from their primary care network to specialty care to home care services. We support every one of those endeavors and all of those operations throughout Monroe County in New York, near the city of Rochester, and we're also a quite large regional enterprise as well. We have many affiliates throughout Monroe County, throughout neighboring counties, and all the way down through the New York State southern tier, where some of those affiliates may have their own leadership, which gets into some challenges we'll probably discuss a little bit later on.
Perfect. Thank you. Thanks for that introduction. Do we have Morgan here? Let me see.
Yes, I'm here.
Oh, hi. Hi, Morgan. Yeah, if you would like to describe your role and introduce yourself.
Sure. Mine's going to be quick because my name is Morgan Underwood. I'm the Associate Director for American Sign Language Interpreter Services at the University of Rochester Medical Center. And I'm essentially Jason's counterpart on the American Sign Language side of things. Rochester, New York has a very large deaf population, mostly considered the largest per capita in the United States and probably in the world. So we have a very large population of ASL users and deaf and hard of hearing patients that we serve here at URMC. So similar to Jason's role, we provide services at 2 of our hospitals, over 60 of our outpatient clinics, and we have a large team of about 35 ASL interpreters. Jason and I have a team of about 10 schedulers between the 2 of us for all of our language access services. And we just serve on a variety of different groups at the university and at the medical center level so that we can make sure that we're implementing our language access policies, procedures, and expectations, throughout the enterprise, hopefully as consistently and effectively as possible.
Great. Thank you. Thanks for being here. And lastly, Yvonne, if you could introduce yourself.
Montserrat, yes, thank you so much for inviting me today. My name is Yvonne Simpson, and I'm in the Seattle area with UW Medicine. My current role is Senior Director for Language Access and Cultural Advocacy. UW Medicine, which is part of the university, has 3 different hospitals and several clinics regionally throughout Western Washington. One of our hospitals is the only level 1 trauma center for multiple states. In Idaho and Alaska that do not have such services, level 1 burns, level 1 pediatric trauma as well at our facilities. We partner quite a bit with some of our other local hospitals in some shared care. In my role, I help to create policy and guidance, training, and other supportive resources for language access. I've been in language access for almost 19 years. I started as a Spanish interpreter in Phoenix. And last year, UW Medicine served more than 500,000 patient visits and hospitalizations for patients who speak English other than English. In addition to utilizing staff interpreters at a couple of our hospitals, we also work broadly with remote interpreters, as well as agency freelance interpreters. We have bilingual staff. Also, one of our hospitals has what we call a very special program of culturally and linguistically equivalent caseworker cultural mediators doing navigation for really complex pieces for patients. And we also have a wonderful resource that serves both our healthcare community as well as the community at large called ethnomed.org. It has, again, some linguistically, but really culturally relevant information so that our teams can better know how to implement. So again, thank you so much for inviting me.
Thank you, Vaughn. I noticed that your audio breaks up sometimes. Is there any way that maybe you can try to reconnect or see if we can hear you better? I
can leave and rejoin. I am at the office, but sometimes our connection is not.
Yeah, it sounds a little low and sometimes it breaks up. But yeah, let's go through one of the questions that we have for the panelists, and we can start with Craig. So, did you encounter any unexpected challenges during the implementation process of writing your plan? I know, Craig, you have shared with us the prototype of the plan that pretty much it is. You can correct me if I'm wrong, about to be published. Is that right? Did you encounter any unexpected challenges with that?
Yeah, so we are in the home stretch of our draft plan, and I wouldn't say that most of the challenges were unexpected. I think we had a lot of expected challenges, but we did start this plan right before and during COVID. So that was certainly a period during which there were a lot of hopes and dreams for projects that got stymied by the demands of the pandemic emergency. And although we did wind up with a draft, we didn't really get it to the finish line. And so I think that was probably the most unexpected challenge in terms of the pandemic. I would say some other considerations that I may not have fully expected were some of the nuances of trying to incorporate both language and disability access needs in the same plan. Although there's a lot of overlap, and I think that there are a lot of sort of common sense reasons why it's a good idea to talk about both of them at the same time, there are some differences in the way those two types of access are approached in federal law, and there are some differences in vocabulary and in requirements, and it's important to preserve those nuances while merging those two topics. So I think that was probably the biggest unexpected challenge that I didn't fully appreciate going into it. We also don't have a full-time language or disability access coordinator. We do have a civil rights coordinator who's responsible for receiving complaints and ensuring that we resolve any specific concerns about disability access, but we don't have a position who's really responsible for writing an entire plan like this and for being the advocate and the champion and the day-to-day administrator across the agency. And so that has been a challenge that we're working to address as one of the initial activities related to the adoption of the plan. I think another challenge is that, as I mentioned before, we have a state supervised, locally administered social services system in Virginia. So a lot of what we write in this plan, we will have to rely on 120 local departments of social services to actually carry out. And although we are responsible for them carrying it out because we are the grantee of billions of dollars of federal funds and they are the subrecipients of those funds, the reality is that we really can't control directly what they do on a day-to-day basis. So a significant portion of this is going to be about training and about cultural indoctrination and that sort of thing, rather than just writing something down on a piece of paper and assuming that it will happen. And then finally, even within state government, we have a variety of different agencies involved in some of the key topics here. So for example, we have a state IT agency that has its own plans and requirements that relate to web accessibility or to other accessibility issues that have to do with IT. We have to make sure that whatever we say jives with whatever they're already saying, and that we try to identify and resolve any potential conflict between those two sets of requirements.
Great. Yeah, so I hear all the time the resources challenge. That's always something that it's needed in agencies. So yeah, and having the local agencies that can be quite a challenge to make sure that they follow the guidance that you provide on that plan. So thank you for sharing that. Yvonne, I understand that your agency has recently also published your language and disability access plan. Is that the name? Is that how you call it, first of all? And what were the challenges?
Yeah, great question. Do I sound better now?
Yes.
Okay, excellent. Thank you for your patience. Our organization, because we are several hospitals, several clinics, we've had our own set of policies and procedures when it comes to language access that have been what I'll call very siloed over the years. And it's only been with the creation of the new system position that I'm in over the last year that we've really had an opportunity to look at how do we make sure that all of our patients, all of our clients, the community, when they are connecting with one of our facilities, they're having the same type of services, that the staff is, consistently aware, regardless of where the patient is at, regardless of even where that employee is working at within our system on a given day, to be able to provide consistent language access services. So we have just recently published what we call our system policy for language access, which that was new for us. And the purpose of that was to really give an umbrella, but also foundational policy for our entire system. The next step is for each of our entities to update their own procedures so that they are in alignment with this shared system policy. So a lot of the foundational information has been there, but with the updates to Section 1557, due to also internal work that we are doing at the University of Washington, we've had some really great opportunities to update some of these items. And we are working on having that system-wide policy actually available for the public to see as well on our websites.
Excellent. I don't believe I capture your link, so you'll have to share that with me after the meeting so I can share that link to with others. So Jason, I understand that you have also, your agency has written also policies and procedures for language access. Did you find any challenges with that?
Yeah, one of the biggest challenges, or should I say one of the biggest surprises, when I first joined this organization back in December of 2019, right before the pandemic started, was that we did not have a language access plan in place, although we did have longstanding policies and procedures that I can certainly talk to a little bit more. So some of the expected / unexpected challenges have to do with that, right? Like trying to take some of this historical information and all of that experience that had been gained since the mid 1970s, and then converting that or trying to convert that into something that was a bit more modern, and also bring on some of these additional legislative initiatives and the different regulations that have come into place throughout the years. And we've already seen a couple of changes to Section 1557 just in the time that I've been here. So it's been a little bit of a wild ride. Certainly one of the challenges I find, or one of the biggest challenges to me, is given the size of our organization, just educating all of the members of the organization on the importance of providing these services, what services are available, the resources that they have that are available to them, whether that be day or night. I know that there are a lot of folks, a lot of different clinical teams out there that are looking for the shortest possible route or the path of least resistance. I don't blame them with all the many demands on their time and all the tasks that seem to continue to pile up for our providers and for us on the administrative end. I can certainly understand the desire to try to shorten that path. But change really, we find, needs to come from both ends. We are happy to help to provide education on the ground for the folks that are in the trenches and actually doing the work, and then also trying to implement or try to influence some cultural change from the top down to make sure that those we're following what it is that we're supposed to be doing, and the folks understand the importance of providing these services for the well-being of our patients and the dignity of patients and our visitors. Being that we're a place of public accommodation. There's also, of course, the challenges of resources, money, time, finding champions that will help to break down some of the walls of those silos that Yvonne was describing earlier. Yeah, it's been mostly, I'd say, education has been the big surprise to me, or the biggest challenge, just given the size of the place.
Yeah, that's super interesting, because we have found a similar experience, and everybody, we can all have a very beautiful written plan put in our website, but if we don't tell people about it, if we don't explain the content of the plan and what's everybody's responsibilities and what you're saying, touching on the training, yeah, you can train your employees, but you have to constantly provide those trainings, because you have new employees coming in every time too, and they have not been trained. So yeah, I understand how that can be
Right.
a challenge. Similar experience? Yeah. Go ahead.
I was just going to say that the challenges are also ongoing as we move more and more into the digital space, where all our interactions are increasingly going to the digital realm, whether that be online on our internet sites, on mobile applications. Like we have an application where our patients can interact with their medical chart. And that is also a challenge, given that is typically available only in English. It might be available in Spanish in some areas, but it's also not as usable as the English version of it. So it's very dependent on the language piece, as well as how tech savvy our end users are as well.
Yeah. So Morgan, do you feel a similar challenge from the American Sign Language aspect?
Very much. I think, like I said before, we have such a large community, and it's pretty well known in Rochester that when you come here, especially to be a provider, you're going to meet deaf patients, but still training providers on the cultural nuances when providing language access to deaf and hard of hearing patients and patients that use ASL, or perhaps patients with hearing loss that don't use ASL, and what that might mean for making sure that your communication is clear and access is really truly there. I think we can spout the regulations to people as much as we want, and we can train them on what they have to do. But if we don't come at it from an empathetic lens and from a patient-centered care lens, or from, a person-centered care, regardless of the agency that you work for, then it's not really going to stick necessarily. It's just going to be one more thing that people have to do. And Jason and I hear often when we talk about trying to get into trainings and get into orientations that, well, providers and these professionals are so inundated with different trainings that it's hard for them to retain the information. So how do we make sure that we are providing trainings and we're providing educational materials that not only will satisfy our requirements, but also really stick with them? And what can we give them? What little nuggets can we give them that are broad enough to help them navigate through what they need to do, give them the resources that they need so that they can find the information, right? We try to make sure that they have the resources to contact us, and that they remember that there are resources available. They don't have to remember all the details. We can help them with that. But just remember that there is someone here to help you, and if you can find the right person, we'll figure out what you need to do. So I think coming at the education from adding some empathy in with the regulations that we have to do is helpful to them, that cultural nuance. And then specifically here, we have different workflows for different languages. So for ASL and Spanish, we have a slightly different workflow than we have for other spoken languages. And how do we make sure that providers remember that if you're looking for a Spanish or an ASL interpreter, you're going to do this because we have an in-person resource for you. But if you're looking for another interpreter, you're going to do this because those resources are harder for us to come by. So trying to package all that into this nice document that people can really digest, I think is one of the biggest challenges, because it's something that we're all passionate about, and I think want to get all that information in so people can make the right choices. But we have to remember that other people have other primary responsibilities, and so they're just trying to do the best that they can with the information that they have, which may not be the same amount of information that we have.
Yeah, that's a very, very interesting, because we try to put all the information based on our needs assessment and everything, and you want to put it all together, but then it can be overwhelming for those that are trying to implement those procedures. So that's a very, very interesting point that you brought up. Thank you for sharing that. So we have another question, and that is, how do you ensure that ongoing compliance and effectiveness of your language and disability access plan? Craig, do you want to answer that from your organization standpoint?
Sure. I think the most important thing, which may sound obvious, is to have a realistic plan in the first place. If the plan does not contain requirements and actions that are realistic, then it's sort of pointless in terms of compliance and effectiveness. And the best way to write a realistic plan is to talk to your stakeholders before the plan is adopted, before the final draft is even really circulated. You don't want it to seem like the train has already left the station by the time you ask for input. And although there are a lot of legal requirements that really can't be changed, there are ways of prioritizing the agency's own actions and resources that are within the discretion of the agency, or maybe the the funders of the agency or the organization, and there may be some discretion there. And so I think it's important to know what you're trying to accomplish, what your business needs are, and to make those things realistic as they're described in the plan. We also have in the plan some initial next steps of training to make sure people understand what we have just committed to and some of the logistics for how to carry that out. So, for example, people need to understand that in certain circumstances, an interpreter is required, but they also need to understand how to actually engage an interpreter's services, or else it doesn't really matter that you have some mention of interpreters in the plan. So there's some very practical training that has to occur in addition to the cultural training, if you will. We also have activities in there about monitoring trends and doing future stakeholder consultation to make sure that this is not a static document that becomes obsolete. But then in terms of some more hands-on activities that we see as the initial next steps, we, as I said before, we don't have a full-time coordinator position, so that is one of our priorities, to make sure that we have somebody who is not just a point of contact, but also somebody who could really serve as a champion for language and disability access across the organization, and who can answer questions and connect people with vendors and other agencies and that sort of thing. And then we also have a program that we've created to administer some funding that the Virginia General Assembly has made available to state agencies. It's not a lot of funding to begin with, but everything helps. And so really money is a way to ensure compliance and effectiveness, because money makes things realistic that otherwise aren't realistic, if you want to put it that way. And then finally, we have an early project to create standard contract provisions that relate to language and disability access, so that whether or not the thing being purchased is a language or disability access service itself, we have incorporated those principles in all of our procurements. So, if we're hiring an interpreter, obviously we want there to be some quality assurance provisions. But if we're hiring a bus to take people somewhere, we want to make sure that that bus company is aware of their obligations in terms of accessibility, and that includes language and disability. So that contract provision and the quality assurance mechanisms that go along with it, I think, are a way to ensure ongoing effectiveness, because we don't want a situation where we have documented 100,000 times when we helped people with language and disability access, but it turns out that we didn't help them very well, or they didn't really get the outcomes that they needed. So the metrics of how many times did you do something are important, but it's more important that the outcome was successful, and that's where the quality assurance mechanisms really come into play.
Yeah, very good. Thank you. How about Yvonne? Do you find any effectiveness? How can you ensure ongoing compliance and effectiveness?
Yeah, I mean, very similar to what Craig was describing, certainly training, and training that's meaningful to folks. And I think Morgan alluded to this as well. Our clinical teams are already so inundated with training opportunities, things that they need to learn, things that they need to remember. So we actually have a doctoral student who's working with us this year, looking at how can we improve the education that we are providing to our clinical teams so that it's done in a way that's meaningful to them, and then that what they're learning is actionable for them. So I'm looking forward to what we're going to get with those findings next year. And then in terms of metrics, I think data is so important. That was really, really impressed upon me by my director when I first moved to Washington, being able to not just state that we're documenting all of our patients who prefer a language other than English, but then really be able to document when services were provided to them, and then be able to do a comparison. And that's a lot. I mean, we're talking like hundreds of thousands of encounters. And so how do we go about doing that QA to see what percentage of those patients are actually having services provided to them. At one of our hospitals, our medical director took it on to do this as a small pilot QA project. And so we got a team together and we're just looking at a few of our specific service lines and trying to get maybe not same day information, but within a couple of days. Who are our patients on the floors? Were they provided services? And if not, because we're trying to get that data back to the teams within a couple of days, what's the reason? What's going on that those services were not engaged for that patient? We have a lot of good opportunities coming up with our organization. I feel fortunate that I'm in an organization that supports language access, that supports good outcomes for patients, and so is willing to provide us with some QA support, some IT support to see how we can leverage the data. We already have lots of data, but how can we leverage that into tools that are actually useful, that don't just tell us the story from the past, but also help to direct us for how to provide better services going forward. So all of those are things that we are continuing to improve upon.
Very interesting. How about you, Jason and Morgan, from your organization perspective?
Yeah, I'll go ahead and get us started. To think about compliance and monitoring the effectiveness and how some of the policies and plans and procedures that we have in place are going, I find that we really need to have a proactive as well as a passive approach. So checking in on patients, staff, and providers on the effectiveness of those services that we offer. On the proactive side, what we do is we look at service volume data reports, see how many interpreters we had assigned in person versus remote, how we're doing there, if we're meeting patient preferences, patient needs in that way. We also have patient satisfaction surveys that go out after visits to ask patients about how their experience was working with the mandatory training modules, regularly attend leadership and staff meetings for in-services as needed. We do interpreter services surveys that are separate from the patient satisfaction surveys as well. I think Morgan can talk a little bit more about that because I think it's primarily geared toward our deaf population and ASL in general. Morgan will also be able to talk about her patient family advisory council. We have internet and intranet sites to educate patients and staff on the services and resources that are available to them. Our internet site even has the pictures of many of the interpreters that our patients will encounter, so folks can see a familiar face when they come into one of their visits. For passive ways of how we monitor it, we do receive event reports every now and again when maybe we might have missed the mark. So that helps us to identify any service gaps or issues where things may have fallen through the cracks. And then that provides us with the opportunity to investigate that and then address the root cause of that issue and just get to the bottom of that. Many times we find the answer is education, but it's always a great exercise to be able to go through and provide do those audits and then provide that education afterwards. And then on an as needed basis, what I've done is audit patient charts and find or look for any kind of documentation, right? So was an interpreter offered? Was an interpreter documented? You know, how is it that we are proving that we provided these services to our patients? So that's some of the ways that I monitor them, and I'll hand it over to Morgan to talk about some of the things that are unique to her program.
Sure. Yeah, Jason alluded to one of the big ones that also echoes something that everyone else has already said, which is stakeholder buy-in and stakeholder involvement. So it is not my patient family advisory council, but the university has a deaf patient and family advisory council. So it is a large group of about 30 deaf community members who have ties both to community organizations that they come as representatives from, as well as ties to the hospital. Now, most people have ties to a hospital, right? You have been a patient or a caregiver in some way. So these council members come together every month and talk about things that are going well from an access standpoint and things that can be improved, specifically from the deaf patient experience. So our medical center has, I want to say 8 or 9 separate, what we call PFACs, so patient family advisory committees, and the deaf one is just one of those numerous ones. So it gives a specific perspective on the patient experience here at URMC. So they talk about things like, of course, interpreter services and language access is a big part of it, but also when clinics during the pandemic would have you sit in your car and they would call you. That didn't feel accessible to some of our deaf patients and patients who do not use the phone using their voice. So they would come up with ideas to talk about, how can we make this accessible for other people? How can we make this accessible for our communities? And they meet monthly, and we've had a number of really good outcomes and good projects come through from that group. And I think, like Yvonne was saying before, it all also comes down to the leadership of the organization and where their interests are and where their investment is. So our organization is invested in access services, is invested in language access specifically. And so our chief experience officer is the person that facilitates those meetings. So her connections, she will bring in representatives from our electronic medical record system to talk about things that they want to implement and get the input from the deaf community before it goes out. So they don't have to go back and retrofit things. The deaf community's input is there in the first place. And it takes a good amount of work, but it also is there's a secondary benefit there that then these people in positions to make changes to systems are learning from the community, and they're learning about the experience of the deaf patients. So then going forward, even after they implement whatever their project is, they're thinking forward about, now I know this, that, and the other thing about this community, and how could that affect my next project? So one of the things that they did implement was specifically an interpreter services survey related to our ASL interpreter staff. So it automatically pushes to them through their MyChart after an appointment, and they can fill out, how satisfied they were with the interpreter. Was the interpreter, were they there on time? Were they professional? There are a number of different scalable questions. And then also there's some open text at the end. It was a work in progress. That's been in place for about 5 years. One of the concerns about that is that it's in written English, which for patients who don't use English as their first language can be a challenge in and of itself. So the committee is revamping it, and they're coming up with a new one that is visual. It's in ASL, and the goal would be that if a patient is in the hospital currently and they have an immediate concern, I would get pinged if they fill out the survey near their discharge and there was some constructive feedback that they wanted to give. I would get pinged, and then I could either call them directly so we could have a conversation, or I would go to them in the hospital if they were still there. So then we could have a conversation about that, whatever the issue is, and we could either resolve it or I could take it back to work on separately. And another thing related to, Jason mentioned the surveys. We work with a company called Press Ganey for our surveys, and Press Ganey is a nationwide company that sends out surveys, I think, in the medical realm, specifically in healthcare. And one of the concerns that came from the Patient and Family Advisory Committee was that those surveys were not accessible to them because they were in written English again. So Press Ganey has come to the PFAC and received their feedback, and now Press Ganey will be producing an ASL version of their survey. And that's going to start here at URMC, but that hopefully will be available to any healthcare organization that uses Press Ganey for surveys. So if you partner with Press Ganey, look out for that hopefully in the next year or so. So getting that this all goes to say getting that stakeholder involvement is really helpful to get a full picture of what the needs might be that we might be missing from a compliance standpoint. There are so many little things, and if we can design universally, designing for one group may help a bunch of other people that we're not necessarily designing for. So if we're using captions, right? I speak English. I appreciate captions almost always. So it's not something that I would necessarily request, but if it's there, it is a good design for me too, even though I'm not the target audience. So the more we're designing for the most diverse people, then we're going to have the best outcomes.
Yeah. Thank you. So in summary, I heard like quality assurance, an important aspect, getting also a stakeholder feedback and involve. I think that's a very great idea. I like the fact of having leadership also participate in that stakeholder feedback so that they can be more committed. And auditing, I think that's an excellent strategy to making sure that the services are happening. If there's any gap of services, I thought that was also very, very brilliant idea. Sometimes I also like to mention monitoring the grievance and the complaints, which is pretty much what you have also mentioned, that if there are any complaints and things like that, that helps, make sure to address and find solutions to have effectiveness strategy. So thank you very much for all those answers. They've been very helpful, and I'm sure it'll be helpful for others. The other question I wanted to touch base with you all is and I think it looks like we have touched a little bit, but let me know if there's anything additional that you want to add about the role that stakeholder engagement play in shaping your plan. Does anybody want to add anything related to the stakeholder engagement that we haven't said already? And feel free.
I can mention a couple of things that
Yeah.
we did early on in the process that really relate not just to the plan, but to other large projects that we were working on. So I think a lot of people have covered a lot already, and I've mentioned that we have 120 local departments of social services. So we also kind of had the unique challenge of representing them, and we made sure to talk to a cross section of departments based on different sizes and geographic locations, and whether they were using state technology and state HR policies or local, and their vacancy rates and their caseloads, and really just trying to get a good cross section. So we did deep dives with about 17 of them to begin with, and then we went back to about 8 of them specifically to do deep dives on language and disability access later. So that's one thing that may not apply to everybody, but there may be some analogy in terms of the kinds of partner organizations that you work with to actually administer your services. We also talked to some of the statewide advocacy organizations for either topics or local governments. So in our case, that meant the Virginia Association of Counties and the Virginia Municipal League. It meant the Virginia League of Social Services Executives and the Benefit Professionals Organization. It meant the Virginia Local Government Information Technology Executives Group. These are all of the IT directors around the state. So that's an example of the people who are going to be on the hook for some of the implementation who don't traditionally get much say in what the original requirements were. And it's a lot better to hear from them, hey, we have these concerns about either the process or the physical functionality and implementation, than to hear that after your plan is in place. So, for example, you wouldn't want to say everybody is going to use fully automated virtual reality, artificial intelligence kiosks in every room of every building. And then, of course, you publish that and the IT folks come back with a million concerns about how that would actually play out in real life. So we talked to them. And then we also talked with the Virginia Poverty Law Center. And I know there are advocacy organizations in many states that are really representing individual clients and individual client concerns like that. And so we got sort of an initial pass on what the big problems and big challenges and big concerns were, and we hope to go back to them before the plan is adopted to get more specific feedback on the individual components of the plan. So I think that those those are different angles, if you will, of stakeholder consultation.
Great. Anything else to add, Yvonne or Jason and Morgan? Perhaps, Yvonne, did you have any direct stakeholder engagement when developing the plan for your agency?
Yeah. Again, like our plan is based on policies that we've had for a number of years, but we do have a connection with our communities, maybe not to the same degree as the University of Rochester, but one of our hospitals does have a deaf consumer advisory council who gives feedback on best communication for our deaf patient population. Seattle also has a sizable deaf blind population, and so we also want to make sure that we're providing the appropriate resources for those consumers. In addition to that, through our caseworker cultural mediator program, we have connection with a number of local community health boards. These are grassroots organizations created by a number of immigrant groups to the greater Seattle area. These are folks who, in many cases, worked in healthcare in their country of origin, and they are really interested in advocacy for healthcare for their communities as they've gone through so much transition. And so being able to hear back from those groups has been really beneficial, even though we don't necessarily have a direct or official relationship with those healthcare health boards. Just being able to connect with them has been really wonderful. So similarly, if your organizations, if your agencies know of community-based or grassroots-based organizations, they may be really great to tap into to learn more.
Yeah, great point. Anything else to add, Jason or Morgan?
Yeah, not too much. I think that many of our responses were kind of interwoven into the responses that we gave earlier, but I can't stress enough that stakeholder engagement is simply not just a one and done endeavor. As times change, as patient needs change, or as stakeholder needs change, then you do have to involve them later on in that process and just evaluate how it is that we can all do better. And I'm very excited to learn that just in the last few weeks we had gotten approved for a Spanish-speaking patient and family advisory council. So I'm looking forward to the work to be done there. And also, we're at the same time as all this is going on, we're also developing our own language access plan and a strategic plan. So a lot of these long-standing policies and procedures that we've had in place, we're really starting to get more consolidated and more just into one place. So I'm really looking forward to all of that.
Excellent.
Yep.
All right, we can move on to the next panelist question. And what advice would you give to organizations just starting to build a language and disability access plan? We can start with Craig.
Sure. Well, first, I think it's really important to identify your organization's values and priorities. And I would say this about pretty much any project or any initiative. If you don't know what you're sort of where you're coming from and what you're trying to achieve, then it's very difficult to have a successful plan or a successful project about anything. And so in this case, maybe to put it bluntly, I would say that some organizations are trying to do the minimum possible to check the boxes so that they don't get in trouble with the law. And other organizations view the law as really a floor or a guardrail and are trying to do something far beyond that. And so I'd like to think that in our organization, we're looking at customer experience as something that's important to us, regardless of whether we're legally required to do it. And of course, we need to do it in a way that complies with the law, but we want to go beyond that and do it because we want to do it. And so that means that a lot of what we're going to have to achieve through training is that cultural change, or that kind of cultural alignment, and that I think is an important starting point. In terms of priorities, that includes financial priorities, fiscal priorities. So if we're not willing to put any money behind something, it's important to know that to begin with. If we have a certain amount of money that we need to stay within, then it would be important not to go outside of that budget and what we are proposing to do in the plan. We have a general statement at the beginning of our draft plan that essentially says that everything the plan envisions is subject to available resources, including funding by the General Assembly and approval by the governor. And that's not intended as an excuse for the things that we don't do, but it is intended to say that there will be things in the plan that are more aspirational than are currently funded. And I think it's important that people are sort of understanding of that in the beginning. The second piece of advice I would give is to do your homework about what those legal requirements are that I alluded to, and also what the customer's needs are. You can't satisfy the legal requirements for the customer's needs if you don't know what they are. So that means having a basic understanding of the relevant laws and a basic understanding of the demographic landscape and the landscape in terms of the demands that will be placed on language and disability access services. Part of that is inherent in the DOJ's four-factor analysis, but I really think that that analysis is intended to kind of establish that you need to do these types of access activities. It's not necessarily going to give you the nuanced level of detail to say exactly what those activities, what those very next steps need to be. Third, I would say don't reinvent the wheel. We were not the first organization to do a language and disability access plan. That's why we started by largely copying and pasting DMAS's plan. Thank you, DMAS. And then we, of course, needed to expand it and customize it from there. And that's one of the reasons we went back and asked DMAS to review our draft to make sure that not only did they give us advice from lessons they've learned, but also to make sure that they were comfortable with any way that we had used their original document. So I'm not saying to steal things without permission. I'm saying to steal things with permission. And then finally, I would say that getting, as we've all said already, getting that stakeholder feedback along the way while the plan is being envisioned and then drafted is very important versus publishing a plan and then asking for feedback, or getting to the very, very final version where everybody knows that you're pretty much about to publish it and then asking for feedback. It's really important to work in that feedback along the way. So those are the four biggest pieces of advice I'd give.
Thank you. Yeah, and I was in the same spot. Like when I first started having to put together in writing the plan, it's like, okay, I need to mimic somebody else's. And luckily there's so many resources out there, so many agencies that have implemented plans that they have the comment section. So I would also encourage everyone to use other plans and just make it yours, but at least the start there. So yeah, I'm glad you guys came to us. I'm so happy of all the collaboration that we can have with all of our agencies to make this happen. But Yvonne, yeah, do you want to provide any good advice for other agencies?
Oh man, Craig's answer was so robust. I was thinking about like what to include, but I was like, that's basically everything. And the only other thing, but I think it goes along with that last point, is reach out for that reason. These types of events are really important. And I love, Montserrat, that you started by having everybody introduce themselves in the chat so that hopefully people can kind of maybe network outside of this meeting and get some help, like how do you do this, how do you do that. Full disclosure, Jason and I used to work together in Arizona, and he and I still collaborate and talk and like, how does your hospital manage this, or what do you guys do about that? And so making sure that, especially if you are the only language access person for your agency, that you find other people who do language access in your area.
Great advice. Thank you. Jason, you want to go next?
Sure. I don't know how much more I have to add, because Craig and Yvonne were quite thorough, and Craig especially. I really I enjoyed that answer. The I don't know, a couple of things that I would recommend is, of course, reach out to colleagues at similar organizations, even if they're out of state. Just benchmark and learn what it is that they're doing in this space, because it's the access plans or the language plans that you're going to come up with for your organization, or there's going to be a lot of different variability across across the different industries or whatever it is that you're working. There's a lot of resources out there that can also help you get started. If you look at on the website for the Center for Medicare and Medicaid Services, look at the Joint Commission, look at federal and state government agencies. There's a ton of resources also and sample language even on the Health and Human Services website, particularly for Section 1557. And those materials can help you get started and find out what works in your organization. And then, of course, engage with shareholders and others in your community who may have been through the same process.
Yes, I agree. Morgan, would you like to add anything?
Just a little bit, hopefully, just a little bit. I think when you just start out thinking about this huge plan and all of the work that you have to do and all of these regulations that now need to be put in place on a timeline, it can be really overwhelming. So there are things I think, like everybody else said, really network, find your content experts. You're not the expert in everything, so know what you're the expert in and then reach out to your content experts and listen to them about the things that you're not the expert in. As well as find the things that your organization is currently doing. Where are you right now, and where do you need to go? And make it manageable chunks, right? By this time, we need to get here, but we can't get here without doing these steps in between. So it seems really, really big and can be overwhelming and a little bit daunting. And you might think, where do we even start? Well, you're already started. There's already something that you're doing. So build off what you already have to get where you want to go. And like everybody else said, there are so many people. There are a lot of people in this group and all over who really want to help and want to work together. So find the right people to network with and take it step by step. Take it step by step and you'll get there.
Yeah, I like the step by step. My experience was also that it was very helpful to start somewhere, and then eventually you're also going to identify the needs, because we started putting the outline of the plan, and then in the middle of it, we were like, wait, hold on a second. We don't do this. We need to start implementing this. So by taking the outline, started filling in the gaps about like, okay, how do we provide phone interpreting services? Who is aware? And then realizing, wait a second, I don't think we're doing this. Okay, let's put that as an initiative. It's like, we don't have any training. All right. So let's put an initiative that we will take care and be realistic, like what Craig was saying before, having realistic expectations. If you're not doing it now, not a big deal. Just say that you're going to do it within the next 2 years, 3 years. But yeah, like taking one step at a time, it's very important because it can be overwhelming when you start. Thank you. All right, so another question we had was, what motivated your organization to develop a language and disability access plan or policies and procedures, and how has your organization made your goals as part of this initiative? Craig, do you want to start?
Sure. I mean, I guess the easy answer that we and many other organizations could give is that we basically have to have a plan, either because it's required by different provisions of the programs that we administer, or because some of the civil rights complaints that we've gotten over the years have suggested that if we had a plan, we might not have gotten that complaint or been in that situation. That's probably the easy answer. But I think really the better answer is that our slogan at VDSS is people helping people. And when I got here, that sounded kind of cute, but I've really been impressed at the almost universal degree to which that slogan is borne out in the attitudes and the actions of my colleagues here at VDSS. People really want to help their customers by administering the programs that they've been hired to administer. We don't love everything about those programs. Many of those requirements are set by federal and state officials that are long gone and we don't have anything to do with and we don't have any influence over. So I think one of the kind of mindsets about language and disability access is try to control the things you can control about the programs you administer. And one is providing an excellent customer experience in all the ways that you have control over. I like to say that if we have a program that our customers cannot access because they don't understand that that program exists, or they don't understand the eligibility requirements, or they don't understand the application process or the appeal process, then that program basically doesn't exist for that customer. And if we are trying to help people, and if we actually have the programs to do it, then wouldn't it be a shame if the only reason that people can get the help they need is because they don't speak English, or because they have a physical disability or a cognitive limitation, or we just explain things in a way that's too complicated for anybody to understand in any language. And I think that's the motivation behind a lot of this, is that we want to improve the experience because we believe in the job we're here to do. We want to help people. We can't magically fix everything about everybody's lives, but there are certain tools we've been given, and the only way to leverage those tools effectively is if people can access them. And that's what this is all about.
Yeah. Yvonne, how about for you? What motivated your organization?
Well, similar to what Craig said, for UW Medicine, our mission is to improve the health of the public. And if we can't communicate appropriately, if our public is not able to meaningfully engage in conversations about their health care, we're not going to be able to meet that goal. And so that has been a long-reaching goal of our organization. And one of our hospitals is our county safety net hospital. And we have a long history of serving patients who communicate in languages other than English. And so for us, while this has been one of our anchor points for decades, by being able to put it into written form in a policy, a procedure, or a language access plan, we're able to say that this is what we do. Then as I'm working with folks, engaging with them, trying to teach them on why we perform language access services, why we have the tools the way we do, certainly I can say, well, it's because it's regulated. We have these guidance requirements. But I can also say it's the right thing to do. It's what makes it easier for you as that healthcare worker to be able to communicate with your patient, because the services are for you as well, not just for your patients or your clients. And so I try to use all of those things to find a way to hook the person into getting on the bandwagon of language access and why we're doing what we're doing. In terms of meeting our goals, a lot of our goals have been met. We're really happy with the services that we provide. We're really happy that we have a reputation of being a place where people can come and get good care through language access. Folks come to our facilities specifically because of that. But we do have additional reach goals that we're working on. And so this is why a number of our QI projects, this is why we're looking at, how can we expand? How can we do more? How can we measure better so that we can set our metrics? So what's interesting in this work is we're never going to arrive. We're never going to get to a point where we've made it. Okay, we're good now. But the language and disability access plan really help us to continue striving for better.
So true. Jason, you want to go next?
Sure thing. Yeah. Again, and not surprisingly, my colleagues have answered quite robustly and thoroughly. So it's just.
I'll let you go first next time.
No, perfectly fine. I'm happy to sit here and learn from them. That's perfectly fine. So motivating our organization to develop a language and disability access plan, really, I find that it's a lot of not only because of regulation, but also because it's the right thing to do. It's really the necessity of the matter to bridge those cultural and linguistic gaps whenever they're present. So like I had mentioned before, back in the mid 1970s, our social work division recognized that need and started taking steps toward delivering those vital services. And Rochester also, as a city, we have the second highest Spanish speaking population within the state of New York. And as Morgan talked about, the largest per capita deaf population in the country, if not in the world. So just due to the important role that healthcare plays in addressing some of these linguistic inequities, whether they're access-based or if they have social determinants, perhaps, our leadership and our healthcare providers really work quite well together and push one another to try to expand those services and make sure that our patients are really receiving what it is that they need. Our patients and our families and any visitors, any folks that need to be welcomed into our healthcare system in order to receive the services that they need. So yeah, I can't really say much more about it. I think all the other portions have been spoken about.
Yeah, Morgan, anything to add?
Just to talk about meeting goals, I think it's one thing to set goals. Are we providing reasonable accommodations? Yes. Are we providing the language access that is, required by us as an organization? Yes. But this is one of those times that, people say, oh, well, they keep moving the goalposts. This is where we do need to keep moving the goalposts, right? As soon as you, very much to echo what Yvonne said, as soon as you get close to those goalposts, it's time to move them. It's time to try for something more. There's not a situation where we are 100% creating full equity for every person who uses a language other than English or lives with a disability. So what are the little things that we can do better? Yes, we are meeting these broad goals that are set out for us, but what are the things that are slipping through the cracks? Who are the people that are slipping through the cracks and why? And how can we make a secondary goal? How can we move the goalposts a little bit? And then if we're moving the goalposts and we're continuing to strive to do better, that is helping other people who are benchmarking against our organizations, right? People maybe on this call that are now benchmarking against our organizations are going to go back to their leadership and say, well, Washington is doing this and Virginia is doing this and New York is doing this. And how can we then make some strides in our own situations to do better? And that, a rising tide will lift all boats. So the more we all move the goalposts instead of maybe resting on our laurels and saying, oh, we met our goals here, we're in compliance, is I think probably the goal for everyone here on this call, and just spreading the word of that, doing good enough is not necessarily good enough. We want to make sure that we're doing better for the people that we all serve.
Yeah, good point. There's so much work to do, and we have to continue to delivering those services and getting better, no matter how far you've reached that goal. I completely agree. Let me see. I think this is our last question. Yeah. So I want to, maybe we can answer the question as briefly, maybe take a couple minutes so that we can leave at least 10 minutes for questions if we can address. So the question is, how did you secure buy-in from leadership or other departments in your organization for this initiative? So I'm going to start with Jason and Morgan now.
All right. I will be very brief because I honestly don't have a lot to share in this regard. I mean, thankfully at URMC, it hasn't been difficult to tie in language access and tie that back to patient safety. And our executive leadership has been highly supportive of any of those initiatives that enhance patient safety and access to care. So we've been very fortunate in that regard. The more difficult piece, as I've alluded to earlier, is just the size of our system, how many players there are that are involved, how many stakeholders are involved, all of the different communities that we serve, involving all of those folks, the different directors, practice managers, patients, inpatient, outpatient nursing leaders, literally everybody. And Yvonne was also talking about the various silos that come along with these types of areas. So that's been probably the biggest challenge at getting buy-in that I've experienced. But for folks that are looking to just get started or get buy-in for their leadership, Yvonne and Craig have both talked about data today and the importance of that. Wherever it is that you can get your data, however it is that you can show the need, is going to be paramount to getting all of those initiatives through.
Yeah, great suggestion. Morgan, anything to add to that?
Just a little, I hope. Like Jason said, you have to have your data and then find your friend, right? There's going to be someone in your organization that has the organizational power that you may or may not have to make this happen or make some inroads. So find your friends. Our department is housed within social work and patient and family services. So we have a lot of allies in patient experience in the social work department. So we have friends in that way that can help us with the organizational power that Jason and I maybe don't have. So kind of, go on a roadshow, take your data on a tour and pitch it to different people, pitch it to maybe compliance, quality, whoever you think is going to listen to the data. And then like Yvonne said, then hook them in with the empathy. And, I like to say to people, like, investing the time in language access services on the front end is going to save you time on the back end, because for us, our patients are going to understand their discharge instructions. Maybe they're not going to come back with the same issue because they understand how to care for themselves once they go home because they have that access. You spend a little bit of time waiting for an interpreter or waiting for your materials to be properly translated. And then that's enhancing your patient's experience. That's enhancing your patient's safety. So then you're getting more patients to come. You're getting more consumers involved in your programs because they're having this good experience. And again, that's what we're all here for, is for the people that we serve in the different realms where we're involved. So investing that time and convincing, it really just has to start with one person, convincing one friend, and they convince one friend. And then, you find your little cohort of people who are going to go and spread the good word of language access to the masses.
So creative. Exactly. Yvonne, do you want to go next?
I concur. Relentless relationship. You find your people and you just keep talking about it until you find your people.
Yeah. Anything to add, Craig?
Well, I'd echo all of that. I would just add that we've been fortunate in Virginia that our leadership really never needed to be convinced about a lot of this. In addition to the firm belief by the people within social services along the lines of what I said before, that we want to help people. Governor Youngkin came in on a platform of improving customer experience in large part, and a lot of his initiatives have really been about trying to look for opportunities to make government work better. I think this is a clear example of helping government work better by making sure that people can access the services government provides. I've worked under two commissioners now in VDSS, and both of them have really been committed to doing this work. I think that the way that you get buy-in from departments that may be a little bit lower down in the org chart is by showing value, showing that we're actually trying to help them. We understand what their needs are. We're not just trying to put more requirements on them. You can't understand people's needs without asking them what they are. So talking to people, considering your internal stakeholders as much as your external stakeholders, I think is really important. And it doesn't hurt to also give them some money. So that's not always possible, but we were able to find this small pot of money the General Assembly made available and use it to give these little grants, essentially, to do some implementation projects. So we asked everybody in the agency for ideas about how to use that money, and I think that hopefully helped a little bit as well.
Great. Wonderful. So this has been an amazing conversation. I have learned a lot from you all. You have been very inspiring. I hope that others would feel that energy and get them to implement their own plans or finish with their implementation of their plans. This has been very helpful. Thank you, all of you as panelists, for this very enriching conversation. I really appreciate your time and your knowledge and your energy. Definitely the energy pays off. I'd like to leave a couple of minutes to see, I know my colleague Jesus has been collecting. I haven't been able to follow the chat a lot. So Jesus, have you collected any questions that maybe the panelists can respond, or I can help respond?
Hi, Monserrat. Hi, everyone. No, we don't have questions at this time about the implementation of language and disability access plan. We have a question from Lydia English. I'm not 100% sure if she was referring about the implementation or the creation of the plan from the Department of Social Services. But her question was if that plan is identical than the DMAS plan.
Well, speaking for VDSS, our plan is no longer identical. We did start by copying DMAS, but we have made a lot of changes, and we've added some sections that maybe weren't there several years ago when the version that we copied from existed. And so we've added a lot to it, and we've made it much more relatable to the specific services and resources that our agency provides. If you were referring to the Virginia Department of Health, and I'd have to refer you to them to talk about their plan. You asked what organizations we oversee in addition to the MCO. If you're talking about VDSS, we provide, and DMAS can correct me on the terminology here, but we essentially provide case management services for Medicaid. So we're talking individual clients about their Medicaid enrollment while we're talking to them about enrollment in TANF and SNAP and child care assistance and that sort of thing. We don't set the policy for Medicaid, and we don't oversee the actual Medicaid payments to doctors. And we're working primarily with those 120 local departments of social services I mentioned before.
Yeah, and I can speak to that since Craig provided us with a copy of their plan, and yeah, there were different sections that they addressed differently. One of the sections that we include in the plan is the nature of your services. For us, for DMAS, we only do Medicaid. VDSS, they carry other programs. So they included the SNAP program. They included all the programs that they oversee. The same as the population. We include in our plan the data for our own Medicaid population. VDSS population has different data, different numbers, different languages. So all that was written from the VDSS standpoint. Any other questions? Oh, that you have identified, or does anybody have any additional questions? We have a few more minutes.
No more questions about the implementation of plans.
Yeah, okay, I see. So yeah, let me share this last screen with you all. This is where I have collected some of the resources that we have already addressed during my presentation and the panelist conversation. These might be helpful. As I said, I will be sharing the presentation so that you have access to those links. But CMS Final Rule Section 1557, that might help you understand what are your responsibilities under HHS. Then the LEP.gov also have good information about how to develop language and disability access plans. We have also included the link to the DMAS plan. And I would encourage you to look at the last one, the self-assessment tool, if you have not completed a self-assessment yet. That has a very good questions that you can complete to do the self-assessment for your organization. So this is the last slide that I have for the presentation. I'm very thankful for everyone who has been here today, from Terry to all the panelists who have provided their time and their knowledge. This, as I said, has been very inspiring. It has inspired me to continue doing more. And I feel like this is the excitement of this line of work, that it's never ending and it's never done, and there's always room for improvement. Everybody has a different need for communication, and addressing those needs, addressing the new technologies like as Terry mentioned, there's always some new policies, new procedures, new technology, new communications, new languages to address. So it's never ending, and it's part of the fun of the job. So thank you everyone for being here today. If from the audience, if you have any topics or recommendations for future topics, let us know. We will be happy to address those topics and learn from each other. Basically, this is our main goal, to hold these discussions, and I appreciate everybody's collaboration and time and participation. Thank you everyone for being here today.